If you went to a sleep study and during the sleep study you have your mouth open, you're breathing faster in upper chest and you're breathing harder, that's going to present you with a much higher severity of obstructive sleep apnea than if you went in the following day or the following week and you're breathing in and out through your nose. Your breathing is lighter, your breathing is slower, your breathing is lower. How you breathe during sleep is going to influence the resistance to your breathing and also the negative pressure in the airways, which in turn is going to contribute to obstructive sleep apnea. Obstructive sleep apnea is when there's a collapse of the upper airway during sleep. It can be a partial collapse whereby it reduces the flow of your breathing to cause your blood oxygen saturation to drop by maybe 3 or 4% or more. Or it can be a total collapse of the airway that you simply stop breathing altogether, and for an adult, it's when you stop breathing for 10 seconds or more. So your breathing during sleep is going to influence that, and of course it's your breathing during wakefulness that influences your breathing during sleep. In other words, when you improve your breathing patterns, that instead of having your mouth open during sleep, is to wear myo tape or to wear some tape to bring support, to bring the lips together during sleep. And also when you do a sleep study, I would really encourage you to get your control pause to a minimum of 20 seconds, minimum. Even better again would be 25 seconds. So 20 seconds is good, 25 seconds is great. Now 40 seconds is excellent. So we start off with 20 seconds. And before you do the sleep study, adopt the same routine that you would do in your normal everyday sleep. So for example, breathe light for 10 to 15 minutes so that you can down regulate so that you can fall asleep quicker and that you're also more likely to have a deeper sleep. So a control pause of 20, 25 seconds plus. Breathing light for 10 to 15 minutes before sleep. Tongue resting in the roof of your mouth. And also breathing through the nose and breathing light and slow and low during the day, which in turn is going to improve your breathing during sleep. So I'll do a quick recap. If you do a sleep study with your mouth open, breathing hard, fast, and irregular breathing patterns, that's going to produce a different severity in your sleep apnea than if your mouth is closed and your breathing is lighter, your breathing is slower, your breathing is lower with a high control pause. So why not spend a few weeks improving your control pause and changing your breathing patterns, and then check out what is your sleep severity, what's your AHI, how many apneas and hypopneas are you having per hour of sleep. And I guarantee you that by changing your breathing patterns during the day, you will significantly reduce your risk of sleep apnea during sleep.